Thank you. Good morning, everybody, once again. I'm Arăta from Romania. Please don't ask what is the main quality of this seminar, because you can see there are a few. I will talk about the impact of the crisis on the Romanian healthcare system. Some preliminary specifications. The presentation is mainly based on the problems identified during a 2-year survey on the quality of professional life and immigration trend of the medical staff in the health sector. As you can see, we are aware that a new kind of action in the trade union must be the research who is helping us to improve our argument in the debate with our new enemy. The survey was carried out by the Center for Research and Social Development Solidarity on the project Professional Training for Medical Staff, Improving the Quality of Health Care Services through professional training and education of medical staff, managers and other category from the system in the southeast region of Romania. A long name, but it is a very pleasure, I guess, for the Commission. The project was financed by the European Social Fund through the sectorial operational program for development of human resources. I guess I must speak a little bit slowly. A short preview of my presentation. I will talk about healthcare on the context of Romanian public services, employees from the healthcare system between economical crisis and decentralization. The third topic, the impact of the crisis on the quality of medical services, relation between employees from public health system and citizens, the effect of European Union adherence on the health system in terms of local public services, another structuring in Romania, few ideas from the draft of new law on health, and I will finish with a few conclusions. First topic, healthcare in the context of Romanian local public services. The main problem is the financial one. I will talk about financing healthcare services in the context of decentralization and fusion. Few general idea. Financial base for hospitals. It's the contracts with National Social Health Insurance Fund. The hospital sector in Romania is consuming about 15% of the National Social Health Insurance Fund, but also there are some investment from local budgets. There is a direct budget allocations from central authorities which finance specific activities such as emergency assistance, support services for specific disease through national health programs, and training and research activities. But the first problem of decentralization on healthcare services, I guess, is the lack of resources at local level. In this case, the decentralization is mainly an attempt from national government to avoid the problems. There are no resources for financing healthcare services at the local level on actual context. And I will talk a few minutes about the problem of financial resources on the local authority. There are few negative factors that are influencing local incomes. First, the demographic factors. It's about employment decrease due to migrations, reduction of natural population growth, you know very well that's a European problem, decreasing number of youth, and also something a little bit specific, large Roma community with illegal forms of housing who benefits of services from the city hall but does not contribute to the local budget. Another kind of factors, the economic factors, three ideas, the unequal economic development of different regions, the economic crisis, and the unemployment problem. The third one, the social factors. There is a lack of cooperation between institutions, excessive politicization of public functions, corruption and administrative level, but also at national level, of course. The political factors, something specific, I guess, delayed approval of state budget law. A consequence of this delay is discrepancy in cost, the existence of special funds, the perpetuation of bad debt, once again, excessive politicization, funds as assignment on political criteria. On the context of the crisis on Romania, we have big decentralizations of healthcare services. A short preview of the situation before the decentralizations. Two ideas: all hospitals were under the control of health ministry. Only some services were transferred to local levels. For example, scholars' health care. Like I said before, in 2010 we have the decentralizations that have it the few objectives and the measures in attentions. The first objective is of decentralizations. It was the transfer of competence regarding the administrations and management of hospital to the local public authorities. And in this process, the national authorities took the following measures: the decentralization of 317 public hospitals from a total of 433 hospitals that were in Ministry of Health administrations. Also, creation of their own management structures for the hospitals at the level of local public authorities. The merging or reorientation of 182 hospitals from the total of 433 hospitals. The reduction of number of hospital beds for efficient delivery of health services. After, as you can see, after reorientation, 4,804 hospitals beds come out of the medical system. The development of a system classification for hospitals based on competences. The evaluation of patient satisfaction on the quality of medical services. As you can see, there are some positive effects of decentralizations. An increasing interest for investments in hospitals that appear sometimes. Maybe quicker problem solving, adapting services to local needs, the resource allocation in terms of needs, and also making the local authorities become more responsible toward the electors. But there are a lot of negative effects of decentralizations, such as limited administrative capacity because of the lack of experience, lack of clarity and predictability in payment transfer, financial allocation on political criteria. One of the subject of our survey told us if the manager is from another political party than the mayor, there are no funds at local level for the hospitals. This is the picture of political criteria allocation. Political management of hospitals. The hospitals are caught in political games of interest. Employment in the system through informal payment, source of income for the political party representatives. The transfer of responsibilities without being accompanied by an equivalent transfer of financial resources. There are more negative effects. Limited capacity to generate local income. Reducing the number of employees, especially on the technical and administrative staff. Emphasizing the lack of staff and limiting staff salary cost to 17% of the revenue from National Social Health Insurance Fund, but it's about a very small budget for the hospitals, for each hospital. Another topic related to the local services problem is social dialogue in local healthcare services. We made this year a collective agreement at the group of units level for the hospitals that are on the Ministry of Health Management. At this collective agreement were joined some local hospitals, but not all the local hospitals are covered by this collective agreement. Also, there is not a social dialogue mechanism for the local health sector. As example for this situation, a case study, a conflict from Braila hospitals is happening in September 2010, caused by the accumulation of following stress factors which come out on employees. A national reduction of salary with 25%. This is a national one, but also there are furthermore, based on decentralization competence, Braila County Council decides another measures, additional salary cuts, layoffs personnel to reduce some costs, merging some other hospitals, reducing the number of beds for patients. In the first image you can see the manager of the hospitals with maybe 5 months before the revolt. I and one of my colleagues, Lydia, we have negotiated on a collective agreement at this hospital without good results, without finishing this agreement. We are knowing. I know very well this director because we spent some time together on this negotiation, and we can say that we have anticipated a little bit this situation. Sorry. Other stress factor for the employees on that hospitals: lack of staff in some departments, poor budget due to unfavorable contracts with the National Social Health Insurance Fund, lack of social dialogue, management based on political interest. The effects of this situation: over 200 employees from emergency hospital of Brăila County have started on Tuesday a spontaneous revolt. People took to the court to protest against the dismissal decision and reducing salary. Salaries. It's a part of from a press article. Spontaneous strikes, blocking the access to institution, forcing entrance to the hospital management, conflict with security force and police. Some image from this conflict we can say that is a typical effect of forced policy decentralizations. The second topic, employees from the healthcare system between economical crisis and decentralizations. The main principle that we are keeping in mind is the quality of professional life. There is a definite negative influence of economic crisis on the quality of professional life. The level of professional insatisfaction is in direct ratio with the crisis effects. The first problem is the lack of necessary financial resources. That is determined by inadequate policy toward the system, the health system, lack of resources. It is also accentuated by economic crisis and fraudulent management, and leads to lower quality of work and life through such factors as shortage of medicine and medical materials, lack of technical equipment, lack or insufficiency of safety materials. Few factors that are causing dissatisfaction in the workplace: the level of incomes, the bad conditions of work, the lack of personal and family time. Another factors that is influencing very strong the quality of professional life is migrations. Two kind of analysis. First, nurses migrations. The analysis made through the push factors and the pull factors. First, push factors of migrations: low salaries, difficult working conditions, limited career route. Pull factors of migrations: possibility of higher income, desire for professional achievement, the bigger degree of civilization. And now about migration of doctors. This image is from 2010. As you can see, we have in 2010 2,779 doctors that are migrated, especially for on France and Germany. This is the map of doctor migrations. The third topic, the impact of the crisis on the quality of medical services. The quality of medical services, it is one of the factors that increases or decreases trust in health institutions. It is also an indicator of life's quality in the community. In Romania, the quality of medical services is low due to migration of medical staff, insufficient funds, systemic deficiencies. One of our subject on the research said the quality in the healthcare system lies in our working condition. If you are very tired, you can easily fail. For example, I am giving you the example of Giulești Hospital from Bucharest. This example, it is an effect of increasing staff shortage. I will begin first with the conclusion. A nurse is on penal investigation for a fire started in a hospital salon with premature newborns. The nurse was taking care by herself for 11 premature newborns. 11 born children, of which 7 have died due to the burns. This is an example of quality of healthcare services. Relationship between employees from public healthcare system and citizens. There are two principal ideas. It's about conflicting trends accentuated by the economic crisis and mutual distrust. The causes: absence of resources to treat patients, staff blamed for shortcomings, informal payments, it's our fault, unfortunately, the shortage triggered by the economic crisis. The effect of European Union adhesion on the healthcare system in terms of local public services. Only a few ideas. The first one is a negative one. For us, the adhesion at the European Union means easier migration of healthcare personnel. But also there are some positive aspects. The process of adapting to European Union standards improve our system, but only when this kind of standards are available. Also, we can talk about the effects of structural funds. There are investment in health infrastructure, investment in human resource, and also exchange of experience. Unfortunately, I must say that we have no capacity to absorb the structural funds. Right now, we absorbed only 4% from structural funds. Don't ask me why, please. Another restructuring, the more important ideas from the draft of new law on health. For dealing with the crisis, our politician, our government came out with a new law on health. What are the main principles? A big privatization of public sector and healthcare, of course. The importance of private insurance company is increasing. Its introduction of complementary insurance. A significant decrease of the National Social Health Insurance Fund role. A significant increase for the number of people who will not receive medical service in the future. And few conclusions. From my point of view, the main risk nowadays is the elimination of the solidarity principle on providing healthcare services. This is equivalent to an attack on the quality of citizens' life. The second risk, lower quality of healthcare for most people on the context of a bigger reduction for the social preoccupation. Health is increasingly considered a good in the sense of products, decreasing its character as citizens' right. For Romania, we can speak about a decline in quality of healthcare due to multiple causes. Paradoxically, a reduction come out in the context of increasing the amount spent on health. The health is not affected by the crisis, but the modality on which the response at the crisis was set up, respectively to the detriment of medium contributor and public sector workers. We must admit a defeat of trade union on public services problems for making a new kind of action strategy. The abandon of the social politics made by a politics orientated on the right, which trend to the radicalizations, but this politic is made also by the left governments, is affecting more and more the public sector. It is a problem of politic mentality that is coming on the economic crisis context, or maybe which lead to the economic crisis. The public discourse is going to the financial resource system, the money being the central topic of the political public debate nowadays. For example, we are expecting the healthcare look like will be made for money and not for the people. On this context, who is having the financial resource is dictating the conditions. What can do the trade unions in these conditions? Only some suggestions. To identify a new social place and role on this new context. To make a radical change of the action strategies adapted at new enemy. To develop a social dialogue mechanism at the local public authorities level. A better organization of trade unions at the local level. It's about decentralization of trade unions. To make a platform for change of experience between trade unions on the action strategy at European level. To promote a new sort of humanism that is not defined through the consuming and by report at the financial resources. And at the end, to change the topic of public debate on the direction of human interest. Thank you very much for your attention.
Thank you very much, Viorel, for your very direct and powerful presentation. I think your point came across very